This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, do steroid injections work for knee pain? If you like this video, we put out new content weekly, so please like and subscribe. So steroid injections for knee pain, very commonly used. So what do they do? When will they work? When will they not work? So basically what the steroid is, there's two types of steroids. There's your muscle building or your anabolic steroid. It's not that type of steroid. It's a catabolic steroid, basically a very strong anti-inflammatory. And when you're injecting it into a joint such as the knee joint, it's providing a very strong anti-inflammatory response into that joint. Usually it's mixed with some numbing medication like lidocaine, and you do that to spread the steroid around. It also gives some idea if you get pain relief after the injection, then we know that the injection is placed properly and that it will probably have a good outcome. So with arthritis, so it depends what you're getting the steroid injection for. Steroid injections aren't really going to heal anything. They're just going to decrease inflammation. So if you have an ACL tear, or you have a meniscal tear, or you have some big defect in your knee, it's not going to cure that. That really can only be done by surgery. But it can decrease the inflammation in the knee, and you might find that after the fact, it maybe doesn't hurt so much. It just depends. Like let's say if you bang your knee and it gets all swollen, you injure the cartilage, sometimes a knee injection there will just calm everything down. Your knee pretty much goes back to normal. People will also get them for osteoarthritis. Now, we used to think that osteoarthritis, most people just call arthritis, was just sort of wear and tear on the joint, and we now know that that's true, but also there's some sort of inflammatory component to it as well, which we believe is why these anti-inflammatories work. So when you get a steroid injection into something like your knee joint, there's some inflammatory process that is decreasing and people can get pain relief. Again, not going to cure your arthritis. Nothing's going to cure your arthritis except for surgery, usually in the form of a knee replacement. PRP, stem cells, it seems like at best those are anti-inflammatories. Nothing's going to regenerate your cartilage. But there's people who maybe don't want a knee replacement and they get steroid injections in their knee every 3 months for a period of years. And they usually eventually do need a knee replacement, but it'll put it off by a number of years and they can have years of basically pain-free existence. So there's also a question, some people will say that the steroids thin the cartilage when they're injected into a joint. So the literature is mixed on this. Some of the literature shows that in low doses it can actually be protective to the cartilage cells, and that in very high doses it can be toxic to the cartilage cells. So with the dose that I normally use, they did a randomized control study where they basically took, I forget how many people, but it was like dozens of people, and they injected them every 3 months for 2 years with either steroid or just saline, meaning just sterile water. And they found that after 2 years there was no difference in any sort of cartilage damage or change. So that's a steroid dose that's double the dose that I regularly use. So I feel pretty confident with my patients that it's not thinning the cartilage, but some people may tell you otherwise. If you use mega doses, it possibly could. But some people will go around saying that. And then also a lot of steroid injections, I know we're talking about the knee, but if we get sometimes for runner's knee, well, it's not actually going in the knee joint, it's just going above and outside the knee joint. And so it's not even in contact with any cartilage cells. But anyway, so the question of will a steroid injection work for your knee pain? For most things it does. It depends. If you have a real serious injury, it's not going to fix that. It's not going to heal anything, but it might reduce the inflammation and allow you to kind of get back to the activities you were doing before. So I hope I was able to answer your questions about if a steroid injection will help with knee pain. If you have any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond, but I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.